and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Valodi, and today we are joined on the podcast by Dr. Heather Porter. And this is a really exciting podcast for us to do because it's one that we have not done, despite the fact that we've had so many podcasts that we've done over the years. We've never done a podcast on hearing, and that is so important for our people, our friends with Down syndrome, and our loved ones. And so I'm so excited, Dr. Porter, to have you on the podcast to talk about this. Dr. Porter is a research scientist and clinical audiologist at Boys Town National Research Hospital in Omaha, Nebraska. So, Dr. Porter, thank you for joining us on the podcast today.
Thank you so much for having me. I'm so excited to be here and to talk to all of your listeners about this topic that I'm so passionate about.
I'm glad to hear that. So give our listeners just a little bit of an idea of who you are, what you do, and what it is about this population that you love working with.
So, as you mentioned, I'm a clinical audiologist and research scientist here at Boys Town. And my dissertation, so even before I got to Boys Town, when I was working on my dissertation, I became interested in working with people with Down syndrome. I have a lifelong experience with hearing loss. My sister was born with hearing loss, and many of my family members have hearing loss. So I have a really good understanding of how it can impact early development, educational progress, and vocational prospects. But when I got to graduate school, I undertook some training in neurodevelopmental leadership education and neurodevelopmental differences. And I became close with some families who had family members with Down syndrome and self-advocates. And often the topic of hearing came up like in passing. And it was interesting to me, coming from a hearing background and experience with hearing, like knowing the importance of it, but then to meet people who had hearing loss, but it was like this back burner item that just kind of nagged at them and, caused problems, but was not really a focus of, any type of treatment plan. It was just kind of this, I don't want to say inconvenience, but, for lack of a better word, this kind of inconvenience that occurred that was maybe a characteristic that they didn't realize something should be done about or could be done about. So that is how I first became kind of passionate and involved. So I looked at hearing in individuals with Down syndrome as part of my dissertation work. And then later here at Boys Town, in the 2019, the federal government started an enormous program to provide funding for looking at co-occurring conditions in individuals with Down syndrome across the lifespan. And that is called the Include Project. I'm sure you guys have talked about that on your podcast.
Yeah.
So we applied for funding to look at hearing in individuals with Down syndrome, because we have that expertise, and we were fortunate enough to get awarded and have been funded since that time to examine these kinds of issues.
That's wonderful. And definitely want to spend some time talking about specifically what you all are studying. But before we get into that in too much detail, why don't you just give our audience just a little bit of an idea of why it is that hearing is so important, not just in people with Down syndrome, in general, of course, but now then specifically in our patient population, why is it that we should be focusing on hearing as much as we should?
Yeah. So kind of the big picture part of it, I think 98% of the population communicates primarily through spoken language. So the likelihood that your listeners are communicating primarily through spoken language is very high.
Mm-hmm.
The way that people get that information, the way that you understand spoken language is through your ears. Someone is speaking and you're listening to them. It takes, even from very, very early on when you're born, that's the way that you're hearing everything around you, you're making sense of things around you, you're learning language, you're learning which language is being spoken in your house, you're then learning to speak that language, you're learning what the different inflections of emotions mean. So very early language and kind of social emotional development, I think, are things that people might not think about very often, but they definitely require, a lot of auditory experience. And then later through childhood, like your brain is doing all sorts of things to figure out how to listen well in noise, and to have good hearing is essential for that. So it's not just about language, but it's actually about your brain parsing out background noise from noise that that you need for informational purposes. And then later on, as you get older, even though you have, your language pretty much developed, your brain pretty much, your hearing well in noise, your auditory experiences, that those systems are set, but you're still needing to communicate for socialization and enjoyment and engagement, whether it's on a personal or professional level. So I think that hearing is the foundation for all of that to happen, and it's something we recognize in audiology. There are guidelines set forth that, sometimes get, they require modification, so I'm thinking about newborn hearing screening guidelines. The guidelines, you want to make sure, it's a law that that all states screen for hearing loss in newborns, but there are guidelines. So when your newborn baby doesn't pass the hearing screening, you should have them rescreened by 3 months of age, and then diagnosed with or without hearing loss by 6 months of age at the latest. So it's the 1-3-6. So screened, diagnosed, and then provided intervention by 6 months of age. So you should know by 3 months of age whether or not your child has hearing loss, and then by 6 months of age they should have intervention if they do have hearing loss. Now, I think that just speaks to the recognition of how this is the foundation, the underpinning from which all your development flourishes. So that's why the focus on hearing is so important.
And is there anything in particular in people with Down syndrome, children especially with Down syndrome, that you would think where optimal hearing would be something perhaps like a different level of importance, maybe more important, or I don't know what the right way to say it. Is there something about their needs for hearing that you would say would impact how you might counsel somebody with Down syndrome?
I would say that the importance of hearing, so rather than it, so that, yes, I wouldn't counsel any differently because hearing is important for everybody. But there are other difficulties experienced by individuals with Down syndrome, children with Down syndrome, that impact development, and that can also be further impacted by hearing loss. I'm thinking about receptive language development and expressive language development. Those two things alone, giving the known difficulties that children with Down syndrome experience there, to throw on an extra difficulty with hearing loss, that I think is speaks to the importance of it. And you hear there's a little bit of questioning in my voice, because it's often in the literature, it has perplexed me that so many people in the literature, like so many studies, but so many investigators have looked at, and they'll say things like there are language delays, there are cognitive delays, there are educational delays, but nobody has examined hearing loss. And we know that hearing loss has an impact on all of those areas. So I think that there are some significant holes in the research that's been done to date, but I think that one of the most important things I want family members to know is that those things we don't want to imply an extra layer of difficulty over top of what your child might already be experiencing.
Yeah, it totally makes sense. And I think that's, the goal of the healthcare guidelines as they've been set up by the American Academy of Pediatrics is that
Mm-hmm.
for really anything, including hearing, that we would make sure that for our friends with Down syndrome, that those things are all being addressed because we want to make sure that we give them every opportunity to succeed developmentally to the extent that they're able to. And I guess my question then is there, in terms of hearing loss in people with Down syndrome, is there what would be your experience, or what would be the data to show in terms of how common that is in people with Down syndrome? Is hearing loss more common, and if so, how much more common would you think?
Now that's a great question because the data are pretty striking. So in historic research, you'll see prevalence rates 40 to 80% of people will have with people with Down syndrome will have hearing loss at some point in their lives. Now, whether that is something that occurred in the past, is something that's ongoing, or something that comes and goes, that's just the general blanket statistic that you'll see. We started our research here thinking, well, that was in the past. We're not going to see such high rates of hearing loss, when in fact, our data are showing very similar rates. So 60% of the people that we've seen so far have some degree of hearing loss right now. 40% of the people we've seen have normal hearing. Now, that type of hearing loss, I think a good take-home message is that hearing loss is more prevalent for individuals with Down syndrome. Absolutely.
Mhm.
It can be the kind of hearing loss that is associated with ear infections or wax impaction. So a conductive hearing loss, something that can be fixed medically, or something that might come and go that requires just ongoing monitoring and treatment. But there are also higher rates of permanent hearing loss, a hearing loss that's on the hearing nerve, sensory neural hearing loss. Some of that might be caused by chronic ear infections for individuals with Down syndrome later in adulthood, but even congenital hearing loss that's present from birth is more common in individuals with Down syndrome. We don't have a good idea of why that is just yet, but it's something that families should definitely be aware of, and why the guidelines, as you mentioned, through the American Academy of Pediatrics suggest annual hearing tests for children with Down syndrome. And I would recommend that on through the lifespan. More often as needed. If there's a suspicion of a problem, hearing tests, are not painful.
Yeah.
At the worst, they're boring, so it makes sense to get them every year.
So I guess earlier in life, when they're first born, you said everybody will get a hearing screen nationally. It's just part of the national recommendations that for everyone. And then for people with Down syndrome or infants with Down syndrome, when they pass that newborn hearing screen, the current guidelines will recommend checking them every 6 months until they're getting ear-specific hearing
Mm-hmm.
that they're able to test for. So can you give an idea of why we might say every 6 months in those first, I don't know, 3 or 4 years of life, until they can tell us what they're hearing exactly in each ear, until we can discover that? Why would we want to do it so frequently in somebody with Down syndrome when we wouldn't want to we don't necessarily have that recommendation for kids who don't have Down syndrome?
So I think the recommendation is every 6 months until you establish what the hearing is like.
Right.
So for anybody that has a risk factor for hearing loss, that is the recommendation. So for an individual with Down syndrome, that's the recommendation, or for a child born without Down syndrome, but that has a family history of hearing loss in children, would do the same thing. And so the hearing screening itself, they're great because they kind of give you a thumbs up, everything looks okay, or you need to get more testing. Once it's indicated that you need more testing, then there's more refined, we look at with more detail at what your ears are doing. So we want to know how the left ear and the right ear can hear at low pitches, mid pitches, and high pitches, because all of those sounds are important for speech perception is what it comes down to. And so you want to monitor for in very young kids and know how they're hearing, because if you find a problem, then you need to provide an intervention, and that is with hearing aids. And you can fit a hearing aid on very on a baby,
Yeah.
and you want to get that in place as soon as that infant child, whenever the hearing loss, you want to get it whenever the hearing loss is identified, hopefully very shortly after it occurred, but you want to get that intervention in place pretty rapidly. And so that's why it's so frequent that you would do it. I think for very young children, it's so important because they can't tell us, they don't know any different. We have a lot of families who come in, even for, families without children with Down syndrome, but just families of young children. And they'll say, I had no idea they had an ear infection. And the idea is probably that kid didn't either. That's just, they're walking around thinking this is what life is. Chronic pain and mumbling.
Yeah, right. And you definitely hit on that, the recurrent ear infections we definitely see. And I would, of course, direct our listeners to podcasts we've done on that before, and retained fluid in the middle ear space,
Mm-hmm.
which can impact that. That's also more common in people with Down syndrome. And you're right, they're, especially when they're younger, they may not be able to say it, feels like my middle ear feels like I'm walking in the middle of an ocean or something like that. They may
Yeah.
not be able to tell. Given the amount of really excellent information that we are receiving from Dr. Porter, I decided to split this podcast into two. So stay tuned for part two of this podcast to come here shortly. But until then, I want to make sure that you all know, if you have any podcasts that you would like us, topics that you would like us to cover on this podcast, please send me an email at downsyndromecenter@chp.edu. And of course, if you'd like to join with us in the work that we do here at the center, including this podcast, please go to givetochildrens.org/Down Syndrome Center. But until next time, bye-bye.